to the hips now. Things related to the IT band issue that we were discussing, just to see if we can kind of loosen up through the hip area, glutes, and the TFL on the side, if we can kind of release a little bit of tension. And then later on, and then we'll also add in a little bit of a quad activation. But you know, definitely keep the quads stretched as well. So any stretches for the quads, let's say it's you know, a kneeling quad stretch, right? Like so, right? Something like that is great for the hip flexors into the quads. Keeping them stretched is great. Of course, for that kind of patellofemoral area, this one's going to be more into the hips. So you're going to start in position like so, and we're going to rotate essentially into this kind of figure 4 position, which you'll see. So I'm just doing a little windshield wiper just to mobilize the hips, trying to keep the just supporting with your arms behind you, keeping the spine nice and tall. So this is step 1, just mobilizing through the hips in internal rotation and external rotation on the other, so opposites. Okay, then we're going to take you into a pigeon. So we're going to roll into that figure 4. You'll see 1, 2, 3, 4 here, 90 degrees. And we're going to have you reach towards the opposite wall. Okay, you can start with hand support, with fingertip support on the floor, but I want you to work up to using your back musculature, if you can, to hold you into this nice deep hip stretch. Take a deep breath. And then lift yourself up. Okay, and then hands down to switch. If you can switch without hands, fantastic. If you can't, use your hands back to this opposite side, hinging at the hips, reaching for the wall, holding. Deep breath in, and then push down into the floor with that lower leg. Lift yourself up, back to start position. So it's kind of a moving, kind of a dynamic pigeon. I'm sure you've seen maybe pigeon in yoga class type situations or other stretches. That's the way I like to kind of combo it, make it a little bit more dynamic, but also active. So you have, you're working to kind of hold yourself up without using your arms and hands. So that's going to be first one for the hips. I know that was a long one. Hang in there.